Welcome to Community Conversations. I'm Frederick County Executive Jan Gardner, and I'm pleased today to have as my guest Heather Kirby, who is the Vice President of Integrated Care Delivery for Frederick Regional Health System. Welcome, Heather.
Thanks, Jan. It's great to be here.
I'm happy to have you today, and I really want to share a little bit about what's happening at Frederick Regional Health System, which many people refer to as Frederick Memorial Hospital. So can you start off by sharing a little bit about your background, who you are, and what your role is?
Sure. So as you heard, my title is the Vice President of Integrated Care Delivery. And the way I like to describe that is my role is really taking what we're doing in the hospital and connecting it to the community. So it's really looking for those opportunities to create partnerships and really serve the community outside of what is the traditional bricks and mortar hospital.
Okay.
My background, I've actually been at Frederick since 1996. It was my first job out of college. And
Oh, wow.
Yeah, I love it there. Started as a social worker and have graduated into different positions, and most recently my current role.
Okay, very good, very good. So recently we announced a partnership between the county and the health department and Frederick Regional Health System for a mobile community health care program. And I'm very excited about it. I think it will deliver better care to people, and it will save both of us money in how we take care of people.
Right.
So can you comment on what that partnership means to the hospital side?
Sure. So from our perspective, we were really excited when Frederick County approached us and said this is a program that they would love to bring to Frederick County. They had folks who are calling 911 pretty frequently, many of those individuals also coming to the hospital very frequently. And from our perspective, it's really about connecting with them in a way that really serves their needs. Because what we find is many individuals don't really require emergency room services when they're coming to the hospital, and we're not able to actually meet what the real need is. And so this new mobile program will allow us to get into the home, really understand the dynamics of what's going on, and provide the services in the best place, which is often not in a hospital setting, rather in someone's home, in the community. And I think Frederick County is so rich in resources and what's available for folks that this gives us the chance to really connect folks to the community much differently than we have in the past. And it'll save money, as you said, but also improve their overall health.
Yeah, I think it's a great idea. And just for people who may be watching, we had 105 individuals who called 911 frequently, about 1,200 times in 1 year. And most of those responses ended up in the emergency department at the hospital. And that cost Frederick County about $800,000 for our response, and I know it's cost the hospital millions of dollars, and yet many of these people have a chronic health need or another issue that we can best meet through a variety of other resources or medical care. And so this program will allow people to go visit those 100 people at their home and really assess what they need and really improve their health and keep them out of the most expensive way to get medical treatment, which sometimes, as you note, is not the best option.
Right.
So can you tell us a little bit about some other things that are happening? I know there's something called the Care Clinic.
Yeah, absolutely. And so the Care Clinic is actually, it's located off the hospital campus. In fact, it's located right across the street from the hospital. And it really is a multidisciplinary clinic where folks who have either been hospitalized or who are in the community and don't have access to care can come and see our nurse practitioner. They can meet with a pharmacist, a social worker, a dietitian, really a multidisciplinary team that are so expert at treating the needs of folks who are either discharging from the hospital back to the community or who are living in the community and really need a lot of intensive kind of one-on-one services that you might not get in another traditional setting. The structure of it is really created in such a way that the nurse practitioner who serves in that clinic has the time to spend with patients, really doing a lot of education, assessments, bringing in that multidisciplinary team. So it's pretty exciting to see that clinic growing.
Now, I certainly understand people who are discharged and how they're connected to the care clinic, but how are others connected with the care clinic? Are they connected through their medical provider, or by when they go to an urgent care and somebody says, well, maybe this is a better option for you?
Absolutely, and folks really can be connected with the care clinic in any way. So that's part of what we've been doing, is getting out into the community and educating, like our AIRS nurses, the Department of Aging, some of our community PCP practices, to let them know that, hey, if you're working with someone in your practice and maybe it's a new diabetic who, you know, maybe needs some more intensive education around diet, medication management, kind of that self-management component. If you're not able to provide that in your practice, you can refer those folks to the care clinic, and we have the staff and resources to do that. So we've been out to some of our local nursing facilities, so as they're discharging folks back into the community, that follow-up care continues to be very important. And so we have some facilities that if they're not able to re-engage that individual with a primary care, they're engaging those folks to the care clinic, and we're kind of carrying on that care for them for a period of time.
Well, that's very good, because again, that has that shared outcome of making people healthier and live better.
Absolutely.
And so how long has the care clinic been up and running? When did that start?
So the care clinic has kind of gone through a couple of phases. So we started the care clinic probably 3 years ago, serving primarily heart failure. So it was folks who had heart failure were coming to the care clinic. And then over the years, we identified, or we determined that people who were coming to that clinic really had good outcomes. And so we've been able to expand it, and that's where we are now. So we've kind of gone from a day or two a week operation to a Monday through Friday, all day kind of functioning clinic. So it's been really exciting to see it grow because it's been so successful.
Very good, and it's great to have successes and then be able to build on that.
Right.
So I know there's a number of other special activities that you're doing, and I know you have a chronic disease self-management workshop program, and can you share a little bit about that?
Sure, and actually the chronic disease self-management workshops are part of the service we offer in our care clinic.
Okay.
So we have been working with the Area on Aging on the Eastern Shore, who holds licensed for these chronic disease programs. And so they have come to Frederick and educated about 33 folks who can now lead and facilitate chronic disease self-management workshops. And so we have individuals from the health system who have been trained, some of our community health workers, a couple of folks from Department of Aging and the health department, who now can go all over Frederick County and hold chronic disease self-management workshops. They're free to anyone who wants to participate. They last about 6 weeks. It's about a 2.5-hour commitment per week for 6 weeks. And it really is all about teaching anyone who's living with a chronic disease to live better with that chronic disease.
Now, are they focused on particular diseases, or are there multiple chronic diseases at the same workshop?
Yeah, so we initially licensed and have been trained on a general chronic disease workshop. So that really could be for anyone experiencing any chronic disease could attend. We also have a hypertension or high blood pressure workshop and a diabetes workshop. Now, we're really excited because they also offer a chronic pain workshop, and we've heard from other counties who have brought the chronic pain workshop to their communities that has been extremely well received and has really been a great supportive program for the community. So our intention is to be able to offer that chronic pain workshop starting next year.
Okay, well, very good, and I really appreciate that. Our public sector providers, whether it's the Department of Aging or our health department, are linked into that, because we can all play a role in trying to get the community well.
Absolutely, and I think that's from my perspective, that's one of the most exciting aspects of Frederick County, is that when we're looking at the programs, it's very easy to invite our community partners to the table, because there's absolutely a shared interest, and we're not out there looking to compete with one another, but really to create an environment where we support one another, are able to have a bigger reach and a bigger collective impact by coordinating and not duplicating efforts. So it's pretty exciting to sit in a room with other folks who are looking to accomplish the same goals.
Yeah, I think that's one of the great things about Frederick, is we really kind of know who these other folks are too, and everybody is really interested in collaborating for the same shared goals. So I know there's a 5210 campaign, and I'm not
Yeah.
quite sure what that is. So
Yeah, so this 5210 is really a relatively new kind of concept for us. Um, but from a health system perspective, we participate and we work together with the Frederick County Health Department on our local health needs assessment,
Right.
which was done in 2016. And as we did that together, it was very clear in our data that we have an opportunity to help reduce the rate of obesity growth in the county. And so as we sat and had conversations and looked at different programs to say, how can we help Frederick County live healthier? We came across the 5210 program, and that really is a program that's all about healthy behavior. So it's about eating 5 or more fruits or vegetables a day. It's about 2 hours or less of recreational screen time, 1 hour of physical activity a day, and 0 sugary drinks. So hence the 5210.
Okay.
And so, other communities such as Maine and Northwest Florida have implemented this program very successfully in school-based programs, in worksite wellness. They've implemented it throughout their Parks and Recs activities, engaged the YMCA. So it really is another program that the community could really embrace and really promote awareness and improving healthy activities and behaviors that I think could really have long-term good outcomes for folks. Because it really is, the earlier you get folks to adopt
with
healthier
children.
behaviors, long-term they're going to be healthier adults, because there is such a connection to chronic disease and, future medical issues. So
Very good. I think that sounds like a good program. So is that just launching?
it is. So, this year we're very much focused on identifying who would our key
the
partners
partners be?
in the Frederick community be, increasing public awareness of the campaign. The great thing about 5210 as well is it's evidence-based. The CDC helped to really define the program. And there are toolkits that, really tell you how other communities have implemented the program and done it very well, and in a way that it's sustainable. So, I think the last thing any of us want to do is to bring a new program to the community and have it not be something that can last. The way we really envision 5210 is that it's kind of part of a bigger platform. It's part of, a Live Well Frederick concept, perhaps, that
Very good.
that really becomes something that outside of 5210 we can continue to build and expand on. Some communities have even done a 52100, and the second O standing for zero tobacco products. So, there are a lot of variations on the program that could really help
You
to
could
promote.
change it over time.
Yep, absolutely.
So there's a lot we could talk about, and we can't talk
Absolutely.
about everything, but I do want to thank you for the great partnership that we've had between county government, the health department, and with you through the Frederick Regional Health System. I mean, I really appreciate your support and role with as we try to address the challenges of substance abuse and heroin and opioids. I mean, we have lots of great partnerships, and I'm really grateful for those. But if people want to get more information about anything we've talked about today, how would they do that?
Yeah, so, I am always available. I love to make myself available for folks, so you can reach me through the health system.
Okay.
All right. Absolutely.
Very good. Well, thank you for joining me today.
Great.
Thank you for joining us for this edition of Community Conversations. I hope you learned a little bit about what's happening at Frederick Regional Health System and how they're promoting good health and living better for everyone in Frederick County. Thank you.